I was only 7 years old. It was a Saturday morning, and my mom had just come into my room to wake me and my sisters up. She told us that we were going somewhere. And of course, as a normal child, I was really excited. In my head, we're having ice cream, maybe going for a party. But you see, that day, we ended up at a home for less privileged children. Prior to that time, my mom had made us sort out our clothes, our shoes, and our toys. And on that day, she made me give everything out. She was a member of the Red Cross Society. She had a first aid box and went on numerous outreaches. And of course, from that day, she made us go with her. At that time in my life, it was not the most interesting thing to do. There were so many other things I could have been doing with my time. There were dolls to play with, there were cartoons to watch, and I could actually just play outside with my sisters. So even though it was not convenient, and even though it wasn't interesting, unknown to me, a seed was being sown and a foundation was being laid for volunteering and service. My university days saw me head out into the sun and organize the same outreaches that I hated as a child. My outreaches were targeted at young girls. I would have health talks with them. I was a medical student, by the way. I would mentor some of them. And then I eventually ended up becoming a pastor in school. Until date, I've still found ways to volunteer with NGOs and other charitable organizations. But you see, when it came to volunteering in an isolation center where COVID-19 patients were being managed, it was an entirely different ballgame. As a medical doctor, I was aware of all the facts. It was a novel virus, a new strain of the coronavirus that was transmitted almost as fast as the speed of light and left a lot of death in its wake. The statistics were there for all to see. The mortality rate was rising. And of course, the headlines were screaming. Thousands of healthcare workers around the world were getting infected. Many of them were dying. And bringing it closer to home, Nigeria recorded its first coronavirus case. So what will make a young medical doctor decide to volunteer in a major pandemic, a major global health concern, decide to risk it all? And I do not speak for myself alone. There are other doctors, there are nurses, there are pharmacists, hygienists, radiographers, lab scientists who have left the comfort of their homes, left their loved ones at home, and they are risking it all, camped as volunteers to curb the ravaging virus. In the beginning, it was scary, really scary for me, because as a healthcare worker, I was the first point of call for any normal person who was sick and went to the hospital. And so I worried a lot for my safety. But then the virus was there in our faces. And I remember watching as the cases started rising and the government was trying to curtail the spread of the virus. So I did videos on social media. I talked about the virus. I talked about its mode of transmission. I also talked about ways people could prevent themselves from getting infected. But then I felt it wasn't enough. I wanted to do more. I really wanted to do more. So I called colleagues that worked in other government hospitals, asking if there was any ongoing research that I could be a part of. The answers were the same everywhere. There was no ongoing research at that time. I'll never forget the turmoil I faced when I started entertaining the thoughts of volunteering in an isolation center. My heart was beating really fast. The fear was palpable. I had found 2 volunteer opportunities and I really, really wanted to do it, but I was afraid. In spite of my fear, I went ahead and applied. That singular action has become the core of everything that I've gone on to experience in the past couple months. The fact that no matter how afraid you are, you should take baby steps. You see, no one ever moves forward by standing still. It's okay to be afraid, but just move. Because fear is such a powerful, crippling emotion that keeps its victims in bondage. You just find that you can't do anything, you can't take any decision, and you are just there, fixed. And so, move. It's hard and it seems cheesy, but just take that first step and then you just watch how things fall into place, because that's really what happened for me. Did I have legitimate fears to be worried? Of course I did. The very first fear was the fear of contracting the virus. The second thing was that I had 3 little children, all boys, who have been at the center of every decision that I make. And I really did not want them to grow up without a mom. And then there was the stigma of being a frontline worker. Now, the stigma is real because it kept me from actually coming out to say I was working in an isolation center for weeks. People see you coming and they treat you like a plague, or they maintain their distance. I mean, social distance is very important, but when it's obvious and in your face, you know that, it's because you're probably caring for COVID-19 patients. And these were first-hand experiences. I got accepted into one of the opportunities, and then I started training and realized that fear usually thrives in the absence of knowledge. Because you see, the more I trained, the less afraid of the virus I became. We were taught on the donning and doffing of the PPEs. I'm sure you've seen most of the videos around. And that singular training alone gave me some level of comfort and security in the system, knowing that a lot of measures were being put in preventing the infection of the healthcare workers. Our center finally opened and received our first set of patients. It was time for me to pack my bags and move permanently into the center. I remember when I left home, the thought occurred to me, what if this was the last time I said goodbye to my children? What if I never saw them again? But typical Niger style, I rebuked the thought and said, God forbid, I will live and not die. But as funny as that sounds, it was my faith that kept me through this period. It's what has kept me, it's what is still keeping me. Because there have been times where my decision has been questioned. I would never forget the time when I was in the center and my N95 mask snapped. And there I was, wondering and worried about what would happen. Of course, I left immediately to doff and decontaminate. But then those fears still linger. But one thing I know has kept me is knowing that I have trusted and believed that God would honor my obedience to keep me safe. One question I usually get from a lot of people is, how were you able to leave your kids at home to do this? It wasn't the easiest decision to make. I remember on Children's Day and Mother's Day, I came online to see other mothers united with their kids and bonding during the lockdown. And I remember feeling bad. But I realized that in the grand scheme of their entire lives, 3 months was the sacrifice I was willing to make to serve humanity and also exemplify courage and selflessness to them. Of course, none of these would have been possible without an amazing support system. You see, the most amazing thing a person can have on their life's journey is to have people that support you, people that cheer you on, and people that encourage you. And for me, it's been my husband, my parents, my sisters, my kids' nanny, and of course, my wonderful friends. At different points in time, these people have come together to support me, to support and help my children. And even at times when I've had depressing moments, just walking there and being overwhelmed, a call has come in to lift me up. Surprise food has come in. And these are the things that keep me going. My colleagues and I have settled into our new reality, wearing our safety boots, our N95 masks, which are uncomfortable, by the way, and sweating in our hazmat suits. But we've been able to do it. We've been able to brace up to the challenges, and we've been able to relish the joy that comes with seeing our patients, some of whom have had severe and critical symptoms, see them get better and go home to be rejoined in society. Imagine what will happen if you left this gathering ready to take on your dreams. Imagine what the world would be like if we all did it afraid. Thank you.